The term kind of makes people think about science fiction. Some people have called this idea suspended animation. And in some sense, that's true. We're basically suspending life. But what we're doing is using science. We're coming up with a new way to try to save people who are dying in front of us. This is not science fiction. Right now, if we have a trauma patient who comes in and arrest, we know that less than 1 in 10 of them is going to survive. And we've all seen people that it turns out they have injuries that we could fix if we just had a few more minutes. What we have been working on, we call resuscitation, which basically means we're trying to stop the clock to buy time for the surgeons. And the way that we're doing that is by using very low levels of hypothermia. Because the lower the temperature is, the less the need for oxygen of tissues, particularly the brain, the heart. And by doing that quickly, our goal is that we can buy time for the surgeon, get the patient to the operating room, and get the bleeding controlled. We came to a point where we've modeled patient scenarios as best we can with the animals, and we decided it's time that we try this in patients. We have a trauma patient come in, and we're looking right now at just penetrating trauma, so it's gunshot wounds, stab wounds. We do what we normally try to do for them. If that doesn't work, then what we'll do is switch to this emergency preservation resuscitation, or EPR. And that will entail taking a large tube, we call it a catheter or a cannula, putting it directly into the aorta. And then we pump in a large amount of ice-cold saline solution. The goal is to use this solution to cool the core of the body, the organs, the brain, the heart, as quickly as possible. And then, as soon as we get them down to the goal temperature, which is around 50 to 55 degrees Fahrenheit, we quickly get them to the operating room. The trauma surgeon will get control of the bleeding, and then we'll slowly warm them up. We think that it'll certainly be safe to do this for upwards of 45 minutes to an hour. But from a surgical standpoint, even 45 minutes or an hour is a lot of time to get a lot done.